This video shows a simulated resuscitation of a man with life-threatening multi-system trauma. And by watching this video, you should gain a stronger understanding of critical decision-making and time-sensitive interventions, including massive transfusion protocol, pelvic binding, surgical chest tube insertion, trauma airway management, and crisis resource management when managing trauma with a team that only includes one doctor. The simulation is performed by me and my real emergency department colleagues, nurses, respiratory therapists, and physicians that I work with every day. The case is run in real time in a single take and is completely unscripted, and nothing has been cut for the sake of brevity. The purpose of simulation is to improve as a team so that when we encounter a critically ill patient in real life, we're prepared to perform at our very best and give that patient the greatest possible chance of survival. If you're new here, first of all, welcome. I'd really appreciate it if you could support the channel by giving this video a like and subscribing. Let's begin. Hello, this is the Emerge.
Hi, this is just a pre-arrival call from the paramedics in the field. We have an unidentified male who fell from the third floor apartment balcony. We were estimating about 20 feet fall. SBP is 80 by manual. Heart rate is in the 130s. GCS is 9. We've achieved IV access in the AC on the left side, and we're giving a bolus of 1 liter of normal saline. It looks like there's some chest wall and abdominal wall trauma. We've put him in a C-collar, and we'll be there in 3 minutes.
Okay, so it sounds like he's pretty unstable. You said that you have 1 IV inserted?
That's right, that's all we could get. He's got pretty thready pulses.
Okay, so given that he's already hypotensive, maybe kind of slow down the IV fluids. I don't want too much of the normal saline going in. And you said that the ETA is?
3 minutes.
3 minutes.
Yeah.
Okay, cool. We'll see you soon.
Great, okay.
Thanks, bye. All right, let's activate code trauma. We have a sick patient that's coming in. So let's get everyone here. I'm just gonna quickly assign roles because we don't have too much time. We have 3 minutes to kind of get set up and prepare for this patient to arrive. So Tammy, you're gonna be on Airway. Andrea, Danny, you guys are going to be hands-on, and it sounds like this patient's already hypotensive and tachycardic, so we have to assume that the patient is hemorrhaging. So I think we're probably headed in the direction of massive transfusion protocols. So Andrea, if you wouldn't mind just managing the blood products. Danny, can you hook the patient up to monitors, get IV access when the patient arrives? Anna, you're gonna be leading the team, and Moses, you can do kind of float procedures and work with me to do some procedures. We don't have another doc for this case, so we're gonna be kind of working as a skeleton crew. All right, cool. So let's, we have a couple minutes to prepare, so let's get the room set up for the patient and we'll get going.
So we'll get the rapid infuser.
Okay.
We'll get some intubation meds ready just in case. We'll get in like airway cart and stuff like that, right, Tammy?
Yeah.
Okay.
Yeah, so I think we should also call down to blood bank.
Okay, we'll do. Just to let them know?
Yeah, would you mind calling the blood bank? Just ask them to send up 4 units of PRBCs uncross-matched, so we'll do O positive.
Okay.
If we could also call for at least 1 unit of FFP, 1 unit of pool platelets.
Okay.
And for medications, I think what we'll need up front is, first of all, analgesia. So we'll need some fentanyl drawn up. We'll need some ketamine, so we can probably just drop 200 cc's in total so that we can give some push doses for analgesia. And then if we need to intubate, then we can push a larger dose. And we should also get rocuronium as well.
Got it. Do you want a gram of TXA?
Yeah, we should get a gram of TXA drawn up as well. And Anna, if you could just direct giving the TXA as soon as the patient lands, that'd be great.
Would you like me to activate MTP now?
Maybe we'll just we'll get the 4 units and all of those things started, like call down the blood bank. But if you could just let them know that we have a really sick patient that's coming in, and we may need to activate MTP. Mo, if you could also run over to CT and just let them know that we have a sick patient that probably needs to be on the CT bed.
Sounds good.
As well. And we should also alert the surgeon on call and let them know that we need to hold one of the ORs for possible laparotomy.
Okay, I can do that.
Okay.
Yeah.
Okay. Do you guys have any questions before we kind of disperse? No?
Okay, so I'm calling transfusion medicine on the phone with blood bank. Hi, this is
so Tammy, maybe we can get all the intubation equipment. So what do we have?
We have a McGrath, we have an 8 tube and a 7.5 on standby. We've got a bougie, and then an iGel backup.
Okay, iGel backup. Okay, perfect. And we have, do we have the massive transfuser? We've got massive transfuser, got a chest tube kit.
Got the massive transfuser.
Okay, it looks like the paramedics are just rolling up to the door of the ER. The patient should be here in a couple seconds.
Okay, perfect.
His patient's arrived.
Hello, sir. I'm Dr. Yu. How are you feeling right now? Sir?
So the patient's only speaking in just words. You can't really get much of a history out of him. He's moaning.
So I'm gonna have to take her clothes off here.
Gonna start
okay?
with the primary survey. So airway appears patent. Trachea.
You notice that it's deviated to the left side.
Okay, trachea is deviated to the left side. I have good air entry on the left side. I don't hear any air entry on the right.
You notice that there's a lot of bruising on the right chest wall.
There's a lot of bruising on the right chest wall. I have normal heart sounds.
Just gonna put some oxygen on your face here.
Abdomen is quite firm and tense.
And there's bruising all along the right abdominal wall
Okay,
as well.
he's got some bruising along the right abdominal wall. And his pelvis feels loose and unstable. So we definitely need to bind that. When I'm feeling his long bones, I'm not feeling any obvious long bone deformities to his femurs. So in terms of disability, let's have a quick look at his pupils. So his pupils are
Equal and reactive.
equal and reactive at 3. And in terms of GCS, so sir, open your eyes.
He opens his eyes to pain.
Okay, so he's opening his eyes
And
to pain.
Andrea, you're
So
establishing
he's got
large bore access?
E2,
Okay.
V2 for moaning, and is he localizing for
He's localizing.
localizing?
Sorry, sir,
okay,
just
so
gonna take this off
M5, so he's got a GCS of 9.
GCS of 9.
Yeah. Okay, so let's quickly summarize. So what do we have for access right now, guys?
We have an 18 in the right ACF and an 18 in the left ACF.
Okay. And how is he to beg?
He's breathing spontaneously on his own at the moment, just
Okay.
providing oxygen.
Perfect. So I'm going to quickly summarize the vital signs and the primary survey. So he's quite tachy right now. We're getting a BP. Oxygen saturations are low at 88%. So just from my clinical exam, it seems like he does have a hemo or pneumothorax on the right side with kind of tension physiology, given that his trachea is deviated to the left. So we need to insert a chest tube, but he's also got an unstable pelvis. So what I would suggest
Just
that we
like,
do, he's quite hypotensive.
We're at 70 over
on
55.
Okay, so we need to start transfusing him right away.
Okay.
Can we start giving him 2 units of
Can I please get a
PRBCs?
porter or an available person to come to trauma?
Yeah.
Okay, I'm just gonna call blood bank, okay?
Perfect.
Hey Jeff, should we bind that pelvis?
Yeah, we should bind that pelvis. So why don't we do a log roll?
I can hold C-spine.
Oh, actually, Tammy, why don't you hold C-spine and then you guys can roll towards you.
Okay, I'm just gonna grab. We got clamps over there, so
Yeah, so why don't I do this? I'll just roll this up.
Brakes are off.
Can you please send the MTP pack? We'll get someone to come pick it up.
So we'll roll towards you.
Okay.
And then I'll slide this under and then you can take that, okay?
Sorry, sir. This is gonna be a little uncomfortable. We're gonna have to turn you to your side. Okay, we're gonna support you.
1, 2, 3.
Okay, so MTP activated
push.
at 7:15. Blank, blood
good.
bank notified.
On your
3. 1, 2, 3.
Excellent. I'll roll slightly this way. You can pull this
Yeah.
through.
1, 2, 3.
Yeah.
Yeah, I got it.
I have 2 units of unmatched PRBCs here.
Okay, 2 units. Okay, let's get that checked.
So we're gonna
Okay.
cross over here.
Yeah. So, do you want to just grab those clamps real
Oh,
quick? Yeah. Okay.
Okay, so cross here.
Patient last name
Okay.
or LEE. Unknown.
Okay, perfect. So I'll clamp on this side, you clamp on that side.
Got it.
The MRN is 111222333. That date of birth is.
Okay, we're secure on this side.
1990.
Yeah.
Secure on this side. Okay,
And
excellent.
we are giving,
Yeah.
And I'm going to quickly do a fast exam, and then if there is a hemo or pneumothorax, then I'll insert a chest tube, okay? I think just for airway, we're going to resuscitate him first because he's hypotensive before we secure that airway.
Got it.
Okay. He's moaning quite a bit. Can we actually get him some analgesia? So Moses, maybe you can give him 25 mics of fentanyl to start.
Are you able to get that, Danny? Yeah.
Yeah, perfect. Unknown male MRN is 111222333.
Perfect.
Okay, here's the
Thank
first
you.
bag.
And we just applied a pelvic binder.
Just apply
Yeah.
pelvic binder. Okay.
All right, sir, I'm just going to put some cold gel on your side, okay? So looking in the right upper quadrant. Okay, so he's got free fluid in Morrison's pouch. Okay, sorry, what was that?
25 mics?
25 mics to start, and we should also give him some ketamine for analgesia. So why don't we do 30 milligrams of ketamine? Okay.
So 25 mics of fentanyl given?
So checking out the pericardium.
No pericardial effusion.
Okay. And looking at the left upper quadrant.
No free fluid in the left upper quadrant.
Okay. The pelvis.
There's free fluid in the pelvis.
Free fluid. Okay. And I'm just going to quickly do the lung ultrasound.
No lung sliding on the right.
Okay. No lung sliding.
Lung sliding on the left.
Lung sliding on the left. Okay. Okay. So he's got a hemo or pneumothorax on the right side and free fluid in the pelvis. Oh, so he's got blood in the chest. So we definitely need to insert a chest tube. Anna, can you call up to the OR and just let him know that he's got free fluid in the abdomen and he's unstable and needs to go to the OR. So tell him to prep the OR and we'll resuscitate him until they're ready, okay?
Sounds good. Hi, this is Edie calling to the
All
OR.
right.
So we have an...
Jeff, I've got the chest tube kit ready for
Thank you.
here. Yeah.
We're going to require a chest
Sorry,
tube
this
and
side,
also
The right side.
has an unstable pelvis. So I was just wondering if you could please hold an operating room and
Mo,
prepare for this
can you
patient.
get the plurivac system set up?
Yeah.
And you know, there's quite a bit of blood on the ultrasound, so I think we should get the cell saver available as well. if
Okay,
you have
yeah,
it.
I'll try and
Okay,
get
can
one
we
from the
please
OR.
prepare for TXA? First bag of
And some cleaning
PRBCs
supplies as well?
infusing at 7:20.
Yeah.
Okay, then we're ready to check the next bag.
Yeah.
Jeff, you're preparing for chest tube insertion?
Yes, I just Andrea, can you just run and grab me a scalpel,
Yeah, scalpel,
and
okay.
also some cleaning supplies, chlorhexidine?
Annie, do you want to check this with me? Yeah. Okay, so this is an unknown male, MRN 111222333. We don't have a date of birth here, so we have O positive. Unit number is C051026535269. Red blood cells expiry date is December 31st, 2027 at midnight.
Okay. You want me to read this off?
Yes, please.
So product code is C05102653.
Okay, I've got the plurivac here.
Thank you.
It's O negative. Expiry.
O positive.
O positive. December 31st, 2027.
Great. Okay. Do you want to work on hanging this one?
Well, I'm going to give the TXA. How
Okay.
much TXA did you want?
What's the dose?
1 gram.
1 gram of TXA?
1 gram over
Yeah.
10 minutes. Or you,
I was
if,
going to give it push.
yeah, you can just push it in.
Okay.
Yeah.
Here, Jess, I'm just gonna add your tube.
Yeah, thank you.
Just, is there an extra line on the other side?
Perfect, thank you so much.
And scalpel.
Thank you.
Okay.
Okay.
So this
Check
was
the butt.
this was checked with Danny.
Okay,
The second
perfect.
bag.
Okay.
So we're good to hang it. Okay.
Okay, perfect. Thank you.
No problem. Mo, can I pass you these?
1 gram of TXA given.
1 gram of IV TXA given, Danny. Thank
What's
you.
the time since the patient landed?
7:10.
Okay, so I made my incision in the chest. My Kelly clamp. Puncturing through.
Sorry.
The second unit.
Oh,
And my
second
fingers
unit
in.
of PRBC's running at
Do we get
7:25.
There's blood.
Blood in there.
Okay. So
Have an intubation meds ready.
Okay, sounds good. Okay, so Mo's working on getting the Sahara set up. Jeff's obviously putting in the chest tube. We have the level 1s going.
Yeah.
Okay, we have intubation meds here. Sats are 86.
Okay, so chest tube is in.
You notice a huge gush of blood.
Okay.
You estimate about 100 to 200 cc's onto the ground,
Thank you.
and it keeps draining.
Okay,
we
so
grab sheets
a lot of
for
blood coming out.
lining?
Yeah, it's filling up here.
Okay, yeah. Good.
I have platelets here.
Perfect.
platelets?
Just take that to
Plasma.
chest.
Plasma? Yeah, no
Plasma,
problem.
yeah.
Okay, let's get that checked.
Okay, let's check. Okay, so
You want to go first?
Perfect. Sats are coming up.
Okay,
Yeah, I'll
what are
go.
we at for stats? 90%? Okay.
His trachea is
One
trachea better.
It's better, it's midline,
Okay.
and you're now up to a liter of blood in the pleurovac.
Okay, perfect.
Okay,
all right,
so
so we have an unknown male. MRN is 111222333. Date of birth December 25th, 1990. We are giving pooled plasma.
Okay, so
unit
let's
number
quickly
is
regroup, guys.
C051026545390. We have an
Okay,
unknown male. MRN
so
111222333.
He's still not intubated. We need to secure that
So we have a
too.
plasma
How much
clot.
blood product has gone in so far?
So we got, we're running 2 units right now.
2 units?
Yeah,
Okay.
yeah.
Is this the fastest that we can push that in? Because he's still quite tacky and hypotensive.
That's the fastest. We're
Yeah.
using a rapid transfuser right now.
Okay. And we have two points of access, right?
Yes.
Okay, can we go for one more point of access? And
Yes.
if we can just try to get another, unit of FFP in.
Okay.
Okay.
And
Who's going to work on the third access?
I can.
I'll do this quickly.
Okay. Can I please get lab for trauma?
And Anna, I'm gonna just delegate to you. You can just manage all of the transfusion stuff. So
Okay.
initially, we'll just
Yep.
go 2 units of 2 to 1 ratios for blood products, and
Yep.
then once we actually get some blood tests back, then I'll let you kind of do the goal-directed.
Okay. I have the
therapy, okay?
algorithm here, so
Perfect.
yeah, we're
Okay.
good.
And also, can we just make sure that we're giving 1 gram of calcium gluconate after we've given 4 units of PRBCs?
Will do. Thank you.
Okay, perfect. So, Tammy, we should prep for intubation.
Okay.
Can we just get ketamine and rock?
We
drawn?
have ketamine and rocuronium drawn here.
Okay, perfect.
Mo, can I delegate that to you?
Yeah, thank you.
So I think we need to secure that tube sooner than later.
Okay.
And I think that this pressure is probably going to be the best that we can get. So maybe we'll just do like a somewhat lower dose of ketamine and we'll go full dose of rock.
Okay, so Mo will be on meds. Danny, after you put the line in, we'll
I'm gonna
need to
pull this out a little
hold
bit, okay?
inline C-spine precautions for intubation, okay? And Tammy, you're at the head of the bed.
Ready to go.
Okay.
I got meds
Plasma's
ready
going in.
here, Jeff.
Plasma
Okay.
is going in?
Yeah.
Okay. First bag of plasma in.
Just let me know when you have that.
Okay, so Mo, whenever you're ready,
Yeah.
you can push ketamine 70.
Okay, 70 of ketamine.
Yeah, and then we'll do rock 120.
120. Okay.
Yeah.
120 rock. Okay, I'm ready for the ketamine.
And we have McGrath,
McGrath.
802. And I think what I'm gonna do, Danny or Andrea, can I get you to do inline C-spine stabilization for me?
Andrea, stay on the rapid infuser, and then Danny will do the
Okay.
C-spine
You got
precautions.
that?
I'm ready with meds
Can I
whenever you
just come in here?
Yeah, that's perfect. So you can just come from the bottom over here.
From the front.
Yeah, you're gonna come from the front. Okay.
No,
You're gonna
hands
come
over
from
the
yeah,
ears.
just like that.
Oh,
yeah,
like this.
exactly. Okay. Just hands on the ears. Okay. Just let this come up. Just yeah, perfect. Let that drop open. Okay, you can push meds.
Okay, so I'm giving 70 of ketamine now.
70 of ketamine being given by Mo, thank you.
Yeah, so that's 70 of ketamine given.
Okay, 70 of ketamine given.
And you can push rock right after.
Yeah. Okay, so this is 120 milligrams of rocuronium going in now.
5 after.
Yeah.
Counting
Okay,
seconds.
120 milligrams
Five.
of IV rocuronium given. Thank you, Mo.
10.
How's the blood product
All right,
going,
I'll
Andrea?
15.
see if I can get a view. Okay, so I've got
Is
a
lab
grade
here?
2 view. I'm gonna sync a bougie.
Okay.
Okay, I'll let you railroad that on. Perfect. You got that?
Yep.
Yeah. Okay, perfect.
Cuff is up. She's out. Do we have end title?
We do not have end title right now. Oh, yeah, 34.
Yeah, perfect. So I'll take that.
Bilateral air entry.
Jeff,
Bilateral
do you want,
air entry?
ketamine for post-intubation sedation, or?
Yeah, we'll do ketamine for
Okay.
post-intubation sedation. So I'll let you secure that tube.
Can I call for chest x-ray?
Yeah, let's call for
portable?
chest
Okay.
and pelvic x-ray as well.
Okay. Can I please get portable x-ray to trauma?
Okay.
Got it. Thank you.
Okay, thank you.
And we'll put the C-spine collar back on.
Yes, let me help you.
Patients on the ventilator.
Okay, patients on
500
the
by
vent.
20, PEEPA 5.
500 by 20, PEEPA 5.
100% at the moment.
100%. Thanks, Tammy.
You have a number 8 tube secured at 24.
Number 8 French tube secured at 24 at the teeth.
Yep.
Thank you.
Okay. Cool, so let's quickly regroup again.
Okay.
So
the
let's
timeout.
get a full set of vitals. So
Full set of vitals,
his
please.
heart rate is 113. Sats are 92. Blood pressure is 87 on 66. Okay, so vital signs are improving. Anna, how much blood product has gone in?
So we're just finishing 2 units right now, and then on the first bag of plasma. Should we call for the second pack to come down?
Yeah.
Okay,
Yeah, and
okay.
I think we should also start massive transfusion protocol, just given how much blood has come out of this chest tube.
It's now up to 1.5 liters.
1.5 liters.
Yeah,
Okay,
okay.
yeah. So we need to be giving him a lot more.
Okay. It is activated, so we could send for more. Yeah,
Okay.
yeah.
What's,
grab the blood.
Yes, please. Okay.
Have we gotten a temp on him recently as well? Because we need to make sure that he's not going
I can
hypothermic.
do that now.
Thank you.
Okay. Also, do we have a body warmer that we can use?
Yeah, we can look for a bear hugger.
Yeah, let's get a bear hugger on him because I just don't want him to go hypothermic.
We can also hang the plasma via hotline. If
That'd be great.
Yeah,
Do we have the blood work back? Can we just call the
So
lab?
the lab, the MTP lab called, there's a hemoglobin of 80 on the initial labs.
Okay.
Platelets of 70, INR 1.8.
Go orally for that.
Yeah.
Ionized calcium flagged as low at 1,
Yeah.
and fibrinogen flagged as low at 1.2.
Okay, so let's start with 1 gram of calcium gluconate, and let's also call for 4 grams of fibrinogen.
Yes.
And just call the lab and just let the blood bank and just let them know that we need
Okay.
more blood products and we need it super stat.
Okay.
We got a oral temperature of 35.7.
35.7. Okay, we need to warm them up too.
So we will need 4 grams of fibrinogen as soon as possible, and we'll need more blood products. Someone's going to come and grab them. Thank you.
I have 2 more units of PRBCs here. Want to
Perfect.
check them with me?
Yes, please.
Okay.
Okay, so we have 2, now 3 and 4. So no birthday. We don't know.
Jeff, do you want the ketamine infusion
All right,
started
so
here?
we
Yeah,
have
let's
an
start ketamine.
unknown with an MRN of 111222333. We are giving red
need some
blood
help?
cells, and we are giving O positive.
Yeah.
All right, you want to repeat back to me?
Yes, so we have an unknown, MRN 111222333.
Yeah.
We're giving O positive red blood cells.
Yeah.
Product unit number is
Thank you.
C051026545642.
Yeah.
Expiry is February 13th, 2027
Yeah,
at
perfect.
midnight, okay?
Yeah,
So this is the
perfect.
3rd bag, and we'll quickly
Okay.
check the 4th bag.
Okay.
Because I think, oh, this one's actually dry. You
Yeah,
want to quickly
I'll
hang
go
this?
hang this
Yeah.
one.
Okay, can we also call up to the OR and see where we're at in terms of OR prep?
Sure.
Okay, so the surgeon and the surgical team called and they said that they're ready for the patient.
Okay.
If you could just bring the patient up because the porter's not available.
Okay, so guys, I think we need to get this guy up to the OR stat because he's bleeding out. And we need to get that laparotomy. So let's try to package him up. I know it's going to be a bit difficult with the level 1 transfuser, but let's just try to hang as many units of blood product as possible so we can transfuse en route to the OR. We'll get transport monitors. Yeah, Tammy's got him on the bag.
There's a transport monitor.
Ready to go.
Oh, 3rd unit of PRBCs is
Okay,
going.
3rd unit of PRBCs at 7:35. Thanks, Andrea. Oh, sorry. Where's the transport monitor? Where's the transport?
All right.
It's like, oh, it's okay. There's a transport monitor? Do you know where it is? Oh, it's on there. No, it's hooked up.
Perfect.
Just as like a tool, like a prep. It's okay. It's fine. It's fine.
1 gram of
I'm gonna check the left.
1 gram of
Perfect, thank you.
calcium. Ready to go. Okay.
All right.
Fourth bag.
So we've given calcium.
Correct.
We've given...
Actually, we haven't hung the fourth bag yet.
Okay.
Yeah.
Okay. All right. So we have an unknown male. MRN was 111222333.
Yep.
We are giving red blood cells.
Yep.
How are we
Unit
doing?
number
Are we
C0510
prepped and ready to roll? Or?
2653972.
Perfect. So unknown male, MRN 111222333. We have O positive red blood cells, unit number
Transfer bar? Okay. I think we got the transfer bar over there.
2653702.
Yeah.
Expiry
so
is February 13th,
you got,
2027 midnight.
level
Okay, the
one.
fourth bag,
Yeah.
calcium has been given. Oh, thank
So
you.
guys, we're gonna start rolling.
Okay, just gonna put this transport monitor here. I'll just disconnect it here.
Yeah.
So just make sure nothing's getting tugged.
Ready to go.
Yeah, ready to go?
So we just need a little bit more slack.
A little bit more slack.
Okay.
Okay, we'll end the case there. That was an incredibly complex case with multiple critical interventions happening simultaneously. And because I was the only physician in the scenario, I had to constantly switch between overseeing the resuscitation and performing procedures. And that kind of role cycling creates an incredible amount of cognitive load and increases the potential for errors, which is why efficient delegation was so important in this case. Anna, our nursing lead, played a crucial role by coordinating and delegating tasks amongst the nursing team, and that allowed me to stay focused on the overall resuscitation and the procedures that need to happen in real time. One thing that always stands out to me, both in real life and in simulation, is how logistically complex massive transfusion can be, because administering blood products is more labor intensive than most people realize. From preparation and verification to hanging products in the rapid infuser and getting it into the patient, it takes a lot longer than most people realize, and it also requires dedicated team members to do it safely and efficiently. If you found this simulation helpful or interesting, I'd really appreciate it if you could like the video and drop a comment with other scenarios that you'd like us to cover. You can also check out the rest of the simulations in the playlist. Thanks so much for watching, and I'll see you in the next one.